Onc Live Insights is a video editorial program produced by Onc Live.
One study I want to mention is a combination study of Ibrutinib with Rituximab in previously untreated follicular lymphoma patients. So in the past, there was a study reporting single-agent Ibrutinib in relapsed refractory follicular lymphoma with a response rate of about 30%, showing some activity in the lymphoma. But the modest response rate was not ideal, so therefore the combination has a potential to improve that. So Dr. Fowler in this ASH 2015 is reporting an abstract combining the immunotherapy with Rituximab and Ibrutinib in treatment-naive follicular lymphoma patients. This is a phase 2 multi-center study that included patients who has previously untreated follicular lymphoma, with 60 patients included. The median age of the patient was 58 years. Patients had follicular lymphoma grade 1, 2, or 3A. Grade 3B were excluded in this study. So all of the patients are meeting criteria for needing treatment for the follicular lymphoma. Patients receive Ibrutinib at 560 milligrams once daily and continue until disease progression or until intolerable toxicity. In addition, Rituximab was given weekly times 4 at a standard dose of 375 milligrams per meter squared, starting from week 1. So the combination was the first 4 weeks, and then after that, patient continued monotherapy with Ibrutinib. The primary endpoint of the study is overall response rate. So after about 10 months of a median follow-up time, the overall response rate for these patients were reported to be 80%, with about 30% of complete response. The toxicity of the patients treated were pretty similar to single-agent Ibrutinib, with no significant unexpected toxicity with the addition of Rituximab. So the take-home message is that combination of Ibrutinib with Rituximab is a very effective treatment for previously untreated follicular lymphoma patients, and the combination has a high response rate with a 30% complete response, and the toxicity profile is very similar to single-agent Ibrutinib. Ibrutinib has been studied in various type of B-cell lymphomas because of its action on the B-cell receptor pathway. As we have discussed, there are studies in follicular lymphoma, but there are also ongoing studies in other indolent lymphoma. There's one ongoing phase 3 studies combining Ibrutinib with 2 immunochemotherapy regimens, either Rituximab bendamustine or R-CHOP. These are conducted in patients with follicular lymphoma and marginal zone lymphoma.